So just go in every single day. You'll be doing this when you're looking for trigger points, maybe, on the trap there. Here, if you rest your finger on top of your clavicle, top of your knuckle is where the lung field is. So, so where my knuckle is, here. If someone's got smoking issues or emphysema, it might even be just slightly here as well. But you see how far? There's a trigger point in the traps. And there's your lung. So you're about 4 centimetres away. You have to really concentrate. These are always going to lead you in. You're not just going to go there. You know, you're always going to do what you do every single day. Trust your fingers and your palpation skills to guide you into where you want to be. So now, that's one location. So when you found the nice little juicy trigger point in the back, just there, in the band there, there's a whole, sometimes a little cluster of them just in the middle of the traps. So okay, orientate yourself, so go, okay, I found a nice trigger point there. I can come at it from different angles, right? I can come this way, but you can see where my finger's pointing down towards. You can come in on the top, on the roof of the trap. But again, on a bad day, on a slim patient, you just might lose your orientation and you're heading towards trouble. You're still finding the same area, just go, but the best way and the safest way is to anterior, posterior is the key. So you're gonna tackle the trigger point, but what's going to happen with the needle? You're just going to pass out the other side into fresh air. You're going to kebab the muscle and you're going to miss everything. So don't come this way, don't come that way, come this way, and you just, look, there's nothing in the way at all that you have to worry about. So get into a habit straight away of tackling it from this angle, and it just straight away gives you a nice layer of safety that you don't have to be concerned about. So I'm right-handed, most of you probably are, so you know, I'm using my left there to, okay, I've got control of it like we all did earlier. Everyone got a good grip on the needle. So just find the trigger point, follow it in. So it's like an extension of your finger. You can clearly see, you can even lift the back of the muscle up there. Just kind of, you can really clearly see the muscle belly. You're a million miles away from trouble. And I am right-handed, so I tend to let go with that and hold the tube in my left. Give it a good assertive tap. Everyone minces it to begin with. Everyone's just a bit. And everyone does it, right? And you will do it, but it's better to be assertive with it and give it a good tap so it all disappears into there, and then you've got through the skin and the fascia, and that's where all the nerve endings are anyway, and then it's much easier, because if you stick around the fascia, you'll just get stuck. Fascia's tough stuff. You don't hit the needle or tap the needle well enough, you'll just get stuck, and this should give us a chance to then you just pick up the needle, keep the angle right, in she goes. Not all the way in, you'd want to see about a third of the needle exposed. It's the right angle, right depth, you're in, and sometimes you get a twitch, sometimes you won't. But if you want to see what not to do, I'm just going to repeat this because there's usually, oh there, see a little twitch on the way in? You catch that? 50% of the time, don't go absolutely obsessed with finding it. If you get it on the way in, beautiful, it's a bonus. But clear little twitch there, that's just nice, good that you saw that. Go on YouTube, and I think first or second is Dr. Adolf.